All right, let's get ready to have a great and wonderful last day of this conference. I hope you guys have met new people, collaborated with new organizations, found out some things that you might not have known, and are gonna connect with people after this conference from other counties, or even in your same county. So this morning, we are in the room, in this room, you should be here for Health to Crisis, paying attention to the spectrum of behavioral health for the whole county. And if that is not the session that you were looking for this morning, you are in the wrong room. Okay? We have 4 wonderful speakers here this morning. They're each going to introduce themselves. I'm going to let you know who they are, but I want to go over a few little housekeeping rules to start out. Don't forget to take a picture or scan the QR code that is on the door as you exit after the session. Don't forget to also complete your session list so that you are ready to submit that after the conference. Use that QR code on that form so that you can learn how to submit that paperwork and also for your CEUs. So we're going to get started. If you have questions, we have a question and answer part at the end, or if you have a question in the middle, please raise your hand so I can bring the mic to you so that you can ask that question so that our people on Zoom can hear as well. So our speakers are Bryce Bodie, Krista Pomeroy, Michael Cokerham, and Rebecca Foley. And I'm gonna let them introduce themselves. Let's give them a round of applause. They are here bright and early this morning.
Thank you, Sonia. We have plenty of room in here for activities. Y'all can move up front if you want to. Real quick, we're going to introduce ourselves and then we'll get started. Super laid back. If you guys have questions during this time, we can throw the mic around the room. No, don't throw it. We'll pass the mic around the room and let you ask your questions. I'm Bryce Bodie. I'm a social worker. I live in Kendall County, Texas, Boerne, Texas, just north of San Antonio. And I have a wonderful family there, a wife who's a librarian, 2 girls that are teenagers, and one that's about to graduate high school and one that's getting there. And I love working with these people next to me. I'll probably brag on them more than they brag on themselves, and I'm going to let them introduce themselves.
Good morning, everyone. I'm Rebecca Foley. I work for Boerne Police Department, and I'm the first mental health officer there. I'm very proud of that. I'm actually in school going to be a counselor, and I'm a year in. I have a year left, so I'm excited about that. I'm very happy to be here as well, working with these people. It was amazing work.
All right, I'm Krista Pomeroy. I am from Boerne Independent School District. I'm currently the Executive Director of Student Support Services. Prior to this role, I've served about 10 years as a school principal, and being in Boerne, it's an amazing place where we are developing these networks and this community that provides wraparound services, and I'm excited for you guys to learn about that today.
Good morning, I'm Michael Cokerham. I work for the Kendall County Sheriff's Office, and I am a mental health officer there. I started this path years ago as a hostage negotiator and realized that what you see on TV doesn't exist. You know, people don't get caught in a bank, trying to get a helicopter and a tank to escape. It was family violence or mental health or a combination of both. And decided a long time ago to exit that field and kind of transition into mental health just to try to get ahead of the curve and maybe stay off some of the things that were occurring by just getting ahead of it. And it's been a ride. We've really gone a lot of places in my previous employment, and then just a lot of work has gone into the mental health, behavioral health side in Kendall County before I got here. And we are now just reaping the benefit of a lot of hard work put in by a lot of people.
Yay. Good job, y'all. So how many folks in here, I want to kind of gauge where you guys are from. Anybody from a county of more than 100,000 people that you know of? Okay. Anybody here from a county with less than 50,000 people? Okay. That gives me an idea of our rural folks versus our bigger folks. Kendall County is right at about 50,000 people. And I want to share some stories with you today. Some of the information we're going to share today could be triggering. It could bring up some stuff. I want to put that out there. I want to give you permission to, if you need to go out, if you need to leave and come back in. Our team is very aware of this. We will tap out and actually come see you outside to make sure you're okay. Even if we have part of our presentation to give, we do this quite a bit. So if you do go out and you're going to the bathroom and you don't want us to follow you to the bathroom, give us a little okay sign to let us know you're okay. But I like to give people that permission before we start talking about some of this stuff, because some of it can be heavy, even for folks that have gone through it or folks that are working with folks going through it like most of us are. So I just want to put that up front. And I have a clicker here, and we'll see if I can make it work correctly. I did. It's amazing. So I've been working in this role for about a year now, not very long. Before this, I worked as a hospice social worker, and I also worked for UTSA's Department of Social Work. I was helping place practicum students for their department, for their graduate school. And I've lived in Boerne and in Kendall County for 20 years. And as a social worker, you always are thinking about micro, meso, macro levels of change, right? If there are any social workers in the room, all right, that's my people. I like everybody else too, I promise. But as social workers, we think about that individual as a client, and then we think about those other systems in their community that affect them, and then overall the other impacts that impact our clients. And all of us, even that aren't social workers, probably think like that, right? We think, how can we change this situation for our clients? How can we make things better? Well, so as I was in this role, I was hired by a nonprofit in Boerne to specifically work with Rebecca. And Rebecca didn't give herself a lot of credit because aren't you an EMT? She's a paramedic. She's a police officer. She's going to be an LPC. She's like MacGyver in the helping industry. So this grant said that I was supposed to be working with Rebecca and Mike. And Mike has a partner, Michelle Quaid, who's not here right now, and Renee. And Renee is the service dog that works with us. Michelle's watching. Hi, Michelle. And this team, the grant said I was supposed to work with them and figure out this red part of the spectrum. And so that's how I was introduced into the behavioral health world of Kendall County. I was introduced to the worst of the worst, right? In this spectrum, I got to see when these guys are showing up, usually it's not because somebody's having a great day. And they work closely with our local mental health authority, which is Hill Country MHDD. I'm sorry, I'm talking really fast. I'll slow down. You're doing a good job over there. So Hill Country MHDD is our local mental health authority. They cover 19 counties, not one county like some of our larger 100,000s. Maybe if you raise your hand, maybe you're part of a different LMHA. 760,000 people in that catchment area, which isn't a lot compared to Bexar County or Travis County, Integral, or Center for Healthcare Services, or Harris County. But those 760,000 people are scattered over a huge area, from Uvalde up to Schleicher County, Hayes County, Comal County, Kendall County. It's a large area. Some of those counties are very small, and some of them are growing very quickly. And we realized really quickly with the crisis calls that it wasn't what I thought it was going to be. So when I started, they put my picture in the paper, and they said, this guy's going to be our social worker for the county. Basically, they told everybody that, and I was like, oh Lord. here we go. And there aren't a lot of social workers in Kendall County. Usually they are in specified fields like hospice social work or connected with CPS or APS. And there's not a lot of us working in the nonprofit world, but that's starting to change greatly. And so when they put this article in the paper, they also put our phone number in the paper, and I come in, and I kid you not, it's the first week I'm working, my phone rings, and it's a mom of a young adult, and this young adult is knowing that he is decompensating, and he has been diagnosed with schizoaffective disorder. He can feel delusions coming on. And mom says, I need to get him into our local LMHA office because he needs his injections and he knows this. And he's living on a property that's a church property out of a storage building. And he's calling to see if he can get meds. I said, oh, this is easy. I got this. Naive Bryce. So I'll just call the local mental health office, and I'll easily talk to them, and we'll get him in there and get his delusions over, and everything will be great. So I call him, and the lady would not talk to me. And then she said, well, I can't tell you whether or not the psychiatrist is here today. And I was like, well, that's silly. And then she said, I can't tell you whether or not the nurse is here today. And I was like, oh, my goodness. And I said, well, I have an officer that's willing to go pick him up and give him a ride to the clinic. If I get him picked up and get him there, can he get his medications? She said, I can't tell you that. I said, who can you tell that? Well, I can tell him if he calls in. So he's right on the edge, right? So I call Officer Foley and I said, hey, do you know this guy? Yeah, I know him. I said, okay, could you give him a ride if possible, if I could get him an appointment at the clinic? She said, sure, I'll go pick, he knows me. And so we never got an appointment. They never gave him an appointment. He ended up walking to town. He ended up getting to Bexar County, outside of our county. He ended up getting emergency detained by UTSA PD, and that was his first of 6 emergency detainments, starting at the end of May, going all the way to August 24th. I know that date, August 24th, because number one, it's my anniversary. And number two, because a whole group of us in Kendall County were meeting together and we were discussing this spectrum and how can we exist gaps in services in this spectrum in our county. Right outside of the door was him and one of our other officers because he was decompensating again for the 6th time. We couldn't get him help. Our local mental health authority was also in that meeting. And so I just grabbed the nurse and said, get him to your crisis stabilization unit. He hadn't been there yet. He had been in San Antonio at San Antonio Behavioral Health, at Methodist Specialty and Transplant, but he hadn't been to the place that knew him, the psychiatrists that knew him, the nurses that knew him, the social workers that knew him, knew his medications. This was my introduction to the crisis in Kendall County. It's been since August 24th, he is back at home with mom, he's working, he's driving his car. We have had no calls on him at all since that time. He's stable, he's in recovery. That's exactly what I wanted to happen that first time that I got that call. And I didn't understand why it was so complicated. So it really made me think about this spectrum, right? It made me think about where is all this happening? Healthy, stressed, struggling. Where are our helping inputs in our school? Where are our helping inputs in our churches, in our community organizations, in our local mental health authority? Where are we taking care of everybody? Because all of us in this room fit in this spectrum. All of us in this room have been in the red. What determines how long we stay in the red is the helping inputs in all the other categories. Does that make sense? So the better helping inputs we get in the healthy and in the stressed and struggling and even the crisis determine how long we stay in the red and get back to the green. And I want Kendall County to know that, but I want you to know that for your counties, even if you're a county bigger than 100,000 people. To do this, we have to collaborate and partner with each other. So one of the things that I noticed in that red category, the worst possible outcomes are emergency detainments, incarceration. We have a high mental health population in our jail system in Kendall County, which is true all across the state. Suicidal outcries, suicidal attempts, and finally, the worst possible outcome in my book is death by suicide. The outcries and attempts and the death by suicide, usually most of those folks we don't hear until it happens. They're not even on our radar, and that's because of stigma. People are hurting to talk. They feel guilty. They feel like this is my problem. I don't want to tell anybody that this is going on. So we have no idea when it reaches this stage, and we need to be paying attention in these healthy and stressed so that we can remove that stigma and get people the help they need when they need that help. So I'm going to turn it over to Officer Foley, and I want to share some of these numbers with you for our county, because I think it's very important that you understand that perspective. You might live in other counties and cities where these numbers are way different, but for us, it's increasing daily.
Thank you. Do I have any law enforcement personnel in here at all? Okay. So I wanted to start with what is an emergency detention. Does anybody know what emergency detention is offhand? So the definition is a peace officer without a warrant may take a person into custody if the officer has a reason to believe or believes that the person is with a mental illness, or because the mental illness, there's a substantial risk of serious harm to the person or somebody else. And there's the 48-hour detainment also that that allows the mental health facility to hold the person for 48 hours for evaluation. So just going over our numbers, of course, we don't want any of these numbers to be at any level that they are right now. And they are increasing. In 2022, it's 121 for us, and for Kendall County, it was 83. As of right now, I did my last stats. We're already at 100 for the end of July, coming up to the end of July, which is not good for us. Okay, juveniles. Our juveniles, of course, we don't want any of these numbers as well. The little asterisk for 2021, we had some reoccurring juveniles that were coming to our attention. We have a facility called Roy Moss. It's kind of, I don't even know what kind of school that is. That's just it's a placement facility for children, foster kids. So that's why our number was a little high there. And also for Kendall County, it was the retreat for girls. So that number was high as well. That was fast.
All right, and in giving you these statistics, I want to remind you, I'm the Executive Director of Student Support Services in Boerne ISD. So currently I oversee our counselors, nurses, at-risk youth, special education, all of those high needs populations that typically are in need of some type of intervention. What has really become significant within our community is kind of what Bryce was alluding to a minute ago, that healthy and struggling, it is an intervention piece. So the most important piece that I want to emphasize, and I hope that you guys get out of this, is the importance of a community coming together, that the school plays a really significant role in that intervention and that prevention piece so that we're not having these emergency detainments. But what's come out of these statistics, and even in working and collaborating with these folks, is that we have continuous wraparound services. So I'll give you our statistics here as a school district. We have just about 10,000 students within our school district, but we're very close to Bexar County. In fact, 2 of our schools fall into the Bexar County area. My experience has always been in the past, I've always worked inner city Title I schools, and it's sometimes more, it's much easier to identify our kids who are in need or who are struggling, as well as our families who are in struggling situations or in crisis, because it's more evident. In a community like ours, where it's, again, the stigma, it's not acceptable to have mental health issues, or it's just kind of under the radar, we have to work more collaboratively. So when we have numbers like this and we look at this, these are our suicide outcries. These are actually outcries that students have made within our school districts, kindergarten through 12th grade. So any outcry can include any self-harm. It can be suicidal outcries. We have anonymous reporting systems, but then we also have extensive training around trauma. We have extensive training around ACEs and things like that. But when we look at our statistics, in 1920, we had 63. However, we shut down for half of that year. So those did not go as reported, as you see. So our numbers increased. 2021, we were open for half of the year for in-person. 22, 23, it erupted, almost doubled. And these are the kids who actually made the outcries through our systems or within our schools. These are not the ones that were made necessarily in the evening hours or on the weekends or during the summer. But you can see the impacts of COVID and also of our reporting system. And then 22, 23, we were at 93. What happens when we have these types of outcries? Within our community, it's not just the school having to address these needs. We have constant communication with our law enforcement and with Bryce. When I started in this position, I actually thought Bryce worked for Bernie ISD because I heard his name so much. And I was like, I don't know Bryce. Who is Bryce? I haven't met Bryce. Where's his office? And it's down the road because he is not part of Bernie ISD, but he's that enmeshed in the work that we do. So, for example, at our alternative school, we may have a student who's in crisis. We have student or school resource officers on every single one of our campuses that we collaborate with. But if we're dealing with a mental health crisis and we've rallied and we've built our brains and we've pulled it all together and we can't figure out what to do with this student, I can call Rebecca right away, or I can call Michael right away, and they come over, and it's another lens that we can look through. But also from that detainment piece, what can we do instead of getting them to the jail or to future incarcerations either? What are we doing as a prevention? It also helps alleviate and decrease the stigma associated with working with law enforcement. So these numbers, although they're significant within such a small community, I mean, we're almost at like 10% of our kids in some cases making not just these numbers, these outcries, but self-harm. Our kids dealing with those stressors. We've developed this community of resources where I can reach out, I can call them in the evenings, on the weekends, whenever it is, to have that law enforcement piece there to support us so that we're a true community involved in keeping these kids and these families healthy.
This next slide is going to be the suicide attempt and threat. Of course, like the other ones, we want this to be at 0 as well. And like Bryce said earlier, these suicide attempts and threats are not always on our radar. So our highest is going to be at 68 and 102, equaling to 170. We want that number lower this year. The next slide is the one that we really don't want. We don't want to see this at all. This is our worst possible outcome. For last year, we had 2. Kendall County had 7. And unfortunately, we're starting off not good this year as well. Mike will go into that as well. That was fast.
So I talked about a lot of the work that went into what we see in our county before we arrived. Our sheriff took office 10 years ago, and when he got into the position, he came as a trooper and worked in our community for 20 years and then got elected as sheriff. Well, now he's over the jail. This is something new. And when you see the number of incarcerated people that have mental illness, he was like, we really have to do something. One of the things that he identified that I think all of us will agree with, when you talk about behavioral health, it's mental health and substance use. And he made sure that every time he talked about it, those two things went hand in hand together. We can't deal with one without dealing with the other. And so they put together an initiative that's been working for years to improve services and to identify gaps that we have. And in one of the meetings, Bryce kind of referred to this was us at the beginning. You know, everybody's kind of got their path of what they're trying to do, what they're trying to move forward to fix. You know, this is our silo, we do this. This is my silo, I do this over here. And the problem is the need does what? It just continues. If we don't address it, what happens? It just continues. Nothing changes. So by working together for a long time, everybody started moving in the same direction, trying to get to, you know, solving the problem. And so this is kind of where we see our county now. Everybody is, you know, linking arms together, they're working together, we get together. When you talk about law enforcement and school districts, how many people have a really good relationship in your community between law enforcement and school districts? That's kind of unheard of, because there's this distrust that occurs in a lot of relationships, because we don't want our children arrested, but if we call them, that's what they're going to do. That's what cops do, they arrest them. Well, not necessarily. You know, we want to help them. We want them in a good place, and you know, we want to work together to resolve the problem. And we've seen that starting to change just because we're getting to know each other and we're actually working to the same goal, the same task. So what do we currently have in our county right now for our crisis response? Kendall County has 2 deputies. Bernie has 1. We have Bryce as a clinician, and we have access to a paramedic from Kendall County EMS. And that affords us the opportunity to assess something. Let's say a crisis call comes out and we're actually available. We're not, you know, here. But if we were available, we can actually go out and assist the officers in the field. And if it's appropriate, we can just take it over. And what happens with that is there's a little change in the way things appear. We show up in unmarked cars. I don't even dress this much like a policeman. My shirt is normally not identifiable. We wear plain clothes, usually untrucked, because we're trying to conceal weapons and handcuffs and things like that so that people don't see that. If it was your loved one, and let's say we were on a schedule and we'd come by about once a week to check on him to see how he's doing, do you want a marked unit parked out in front of that house once a week? What are neighbors going to say? What's wrong? Something's wrong. Why are they always here? But we show up in something that nobody can identify, nobody cares. Maybe that's one of his friends, we don't know. You know, they just come by and check on him. So we moved into a partnership with STRAC, Southwest Texas Regional Advisory Council, because we have gaps of services. We don't have beds in our county. There are no treatment beds available. We have a dock-in-the-box ER that's connected with Methodist out of San Antonio. And that's really all we have to take somebody to in our county. And when you look at services like that, it's telepsych. And so when we take somebody in and they're in psychosis and I want them to talk to a TV, I don't think that's appropriate. And so we were always looking at what can we do. Well, STRAC has paid beds that we can utilize. So we're currently in a partnership with them trying to purchase beds. So instead of us figuring out where we're going to take somebody, they're paid for. We know where we're going. And treatment is usually better when it's paid for already, right? You know, we don't have to worry about it. It's like, well, are they funded, unfunded? Doesn't matter. We're paying for it. They have a place to go. And so that's what we're currently working on with them. And then partnering with the school district. We've got two school districts, Bernie and Comfort Independent School District, working with the counselors and the SROs. We had a situation that came up. We're going to call him Levi. University of Texas called us because they had a college student that was in crisis and they needed a welfare check. And so this was in the evening by the time the call came in. So our patrol deputies were sent out. When they get to the house, there's a very combative young man who had cut himself. There was dried blood down his arm. He was wearing a long sleeve shirt. He was extremely aggressive. And they called and said, what do we do? They spoke to my partner, and she's like, if the blood's dried, he's no longer bleeding. We'll deal with it tomorrow, because if you try to take him into custody right now, it's going to be a fight. So we went out and checked on him the next day, still extremely aggressive, and we talked to the family member to try to see if there's anything that we could do to help them and do some referrals, and realized that he's just angry right now. He's probably not in danger, and we'll let this lay for today. So things started to continue to develop in this case, to the point that we ended up on a Zoom call. It was us, it was the University of Texas, San Antonio Police Department, it was the San Antonio Regional Fusion Center Threat Assessment Team, it was the school administrators, it was our probation office, so on and so forth. A lot of people on a Zoom call. When everyone got to talk about their connection to, we're going to call him Levi, we realized we had a real serious problem, and something had to be done immediately. He not only was in school, but he was not Asian. He was joining Asian clubs to have access to women. He was targeting them, and there were already 4 complaints filed against him for very inappropriate situations that he was involved in. And he was fixing to get expelled. He was in a program not for dumb people. He was extremely intelligent, and that got us nervous is probably an understatement because of the level of intelligence that he has. We figured that would make him extremely more dangerous. And the decision was made from the threat assessment team from Fusion that he needed to be taken into custody immediately. So he was supposed to be in class. We didn't know if he would be there or not. So the university sent people to his classroom to get him if he was there, and we sent deputies to the house. We actually found him at home. We took him into custody, and we got him immediately into a hospital to be assessed by a doctor that works with the threat assessment team. I got to meet with him a week later, and I said, what do you think, doc? And he said, when you look at mass murders and serial killers, there's a bunch of checks box. He checked them all. He goes, the question, though, is will he do it? That's the question that we can't answer. So this is somebody that we feel like we intervened. He is now incarcerated. He is at a safe place. People are safe, in our community. We sat down and started talking, and we were meeting with the school district and meeting with counselors, and things were being said like, oh, I remember when he was in kindergarten. We figured this might happen. Yeah, we're not surprised. And we realized, wow, a couple things. We identified it at the age of 6 that there's a future problem. And at the time, our community had nothing to deal with that. And so when you look at somebody that is identified at 6 years old, and you look at all the problems that they've had throughout their life to get all the way to college, unaddressed, look what happens. And so we were motivated to say, look, we don't want this to happen again. We want to get together. We want to identify. So when the school district says we communicate directly? We do. We come in contact with a child whose family has been in a very serious situation over the weekend. We immediately send this to them and say, look, if so-and-so shows up Monday morning and has an outcry, has an outburst, now you understand why, because they had a situation. And the information comes back the other way. You know, we had a problem with the school that may not have been addressed completely. This may spill over back at the house, and you may be dealing with it. So we're working back and forth to identify problems and to move forward to fix those in our community with the kids, so that we don't have somebody that shows up, 15 to 20 years later, and we have a situation where we go, oh yeah, we saw this coming, but we just didn't have anything to do with it. So we see this as a success, even though we've had, a failure. We're trying to learn from that and move forward and not make the same mistake again. The next thing that we did is, again, Hill Country MHDD, partnering with them on a level that we've never done before. We have weekly meetings with them over the people that we touch that in law enforcement settings that maybe are their clients, and just make sure that they're aware that we've had those interactions with them so that they're not caught off guard by something that's going on, and maybe they can intervene. Or maybe they've had somebody come in the office that they want us to be aware of, that if something happens, that we have a little bit of information going into that situation.
All right, through our partnership, we've had the opportunity to add staff to our district because of grants that these organizations can write, or in particular, Hill Country Family Services can write, and we can split fund. For example, we've added a peer support specialist. So our peer support specialist, Justin, comes to us with real life experience. He is a certified PRS, and he comes and serves all of our school district. He's in all of our schools, but in particular, working with our kids who have dealt with substance abuse. We know with new legislation and the vaping and all of those laws that are going to force our kids to go into potentially mandatory placements, Justin's going to have a huge role in serving our students to help them if they're dealing with substance addiction or any type of habits that we want to, again, try to address within our schools. We don't have the funding necessarily to pay for these support personnel, but our community does, and they're committed to bringing those personnel onto our campuses and to serving them directly. The other thing that we've added is Hope Squad, and Hope Squad is a program, the numbers that I showed you earlier with the self-harm and the suicide risks that we're faced with. The Hope Squad is a program that we've added where our students are trained to serve as peer mentors or peer support. They're those safe people on campus who, if a student is struggling with their mental health and they are feeling like they want to self-harm or potentially take their life, they can identify with members of their peer group that are called the Hope Squad members. The Hope Squad members are trained and they know what to look and listen for, and they can refer to the appropriate staff member on campus, whether that's a teacher leader or a counselor. There's a lot of training that goes into this, but it's that mentoring and that partnership and just the ability within the trenches, the students are able to identify some of those crisis indicators, and they can alert adults. It's been a great partnership. Again, as Mike mentioned, we are getting the 24/7 alerts, certain personnel within the district, and I can give you an example. We had a student whose father had passed away in the evening, and that student was going to come to school the next day because they hadn't let the child know, just with everything that was going on during the crisis. But the child surely could sense something was wrong. Dad wasn't at home, and they were able to let the school know. We don't inform and blast it out, but we let the appropriate people know that this child needs to be handled with care. And so that we're all alert. We also can kind of triage within the school district and let people know, the important people know, that we need to intervene. We need to help restabilize the family or the situation and bring them back to a healthy state. And we do that through constant collaboration.
Okay, we're finally in the green. Anybody heard of Mental Health First Aid? It's a great program. So we have 11 certified instructors, all with Kendall County EMS, the Sheriff's Office, Boerne PD, the City of Boerne, Boerne ISD, Hill Country Family Services are all trained in adult, youth, and we have one Spanish speaker instructor, which is really great. The last thing is the trauma support for first responders. We had a speaker, his name is Travis Howes, and he came to, actually he came to the New Braunfels area and the Boerne area. So he spoke, he's a firefighter, ex-military, and police officer. He checks all the boxes in that area. So he was talking about his mental health and how there's a big stigma with first responders. And we got a chance to send a lot of our first responders there. And we got really good feedback. So if anybody gets a chance to see him, he's online, and he has a book out also. It's really good for first responders and their mental health.
Thank you, ma'am. So there were also counselors actually from our school district that showed up at that training. Travis is rough around the edges because he checks all those boxes. So I didn't know how that was going to go over. We had a disclaimer at first, but apparently in the first responder world, that does not faze them. So mainly that was for our counselors to say, hey, this guy is he's a Marine, so he's going to say these things. But that had a huge impact because in these areas, these are just some of the things that Kendall County has done in a year. And really and honestly, why I wanted to show these things and this spectrum is because I want other helpers and other people to hear this and picture this. Collaborations are what's going to move the wheel. Whether you're a big city, big county, small county, but collaborating with folks and working with folks and those arrows that we had earlier, what Mike was saying is that need doesn't care. It doesn't care if we do anything about it. You know that. The need's going to be there no matter what. Whether we help, whether we partner, work together, whatever we do or don't do, it's still going to be there. It's still going to exist. So if we head in the same direction, we're doing something about it. We're addressing it. And there's a whole lot more things that are occurring in that spectrum. I see now I'm disappointed I used these dark slides, but on this spectrum, one other thing that I want to share, and I think we have a little bit of time to share this. One of the reasons why I wanted to share these stories is because I think it captures this entire spectrum. So the story that Mike shares about Levi is the one that we figured, what was happening here for him? Where were we when that kindergartner, it was a counselor that had him in kindergarten and said, oh, I remember him. Where was this happening? And where were people paying attention to that for their families too? Sonia and I were talking about this. So her wraparound services, we were talking about those wraparound services. If we had a magic wand, which is also a social work thing, what would we like to see? That whole family. Because what Mike didn't share with you is he lived with his grandma and had for a really long time. We know adverse childhood experiences right there. We know he's experienced trauma in his life and continued to, right? And so if we had that magic wand and we could wave it, then we could exist in that healthy area and have good helping strategies in that healthy area. But that doesn't happen if you're by yourself. It doesn't happen if it's that one counselor at that elementary school campus. It doesn't happen if our law enforcement doesn't recognize the need in our county and community and the importance of communication. So I think that story is very powerful, and it struck me. This is when this spectrum actually came to me, is one day I was at the sheriff's department. Once again, I really have no office. I'm at the sheriff's department. I'm at the school district. I am the county social worker. God, I hope we hire somebody else soon. And I was at the sheriff's department, and we get a call, and it was a death by suicide. And this hits really close to home to me because right before we get this call, I decide it's important to share with Mike and Michelle that when I was 15 years old, my cousin died by suicide, and I was the first one to see him. And so I figured, it's important for them to know this, just in case we make a call and Bryce falls apart and runs out of the room, that it's important for them to know, right? And then, I'm not kidding, I just finished telling them this. Somebody walks into the office and says, "Do you want to go?" And Mike looks at me and he's like, "Are you okay?" And I was like, "I'm good, man. There's a reason I shared that with you. We'll be all right. We'll go make this call together." So actually our other partner, Michelle, and Renee, the service dog, and I went in and spoke with the spouse and heard this. This person was in their 70s, very successful, lived in a very nice neighborhood, was a grandparent, and everything looked on the surface like it was going right. When they were younger, before even entering school, they experienced abuse and continued throughout their lifespan to struggle. Substance abuse, trying to address those traumas and problems. And no helping inputs showed up in their life on this spectrum. And then here we get to, you're retired, you're living your life, everything looks okay on the surface, and he ended up being one of those numbers. And that scared me as an individual in the county because I want to see those numbers be zero. Zero emergency detainments, zero suicide attempts, zero suicide outcries, zero suicides. And when I said that in public, people laughed at me for saying that. "Oh, that's never going to happen." They were cynical about that. I want to see this happen not just in Kendall County, but all 254 counties in the state of Texas. If we can look at the spectrum, because we're all on it, I don't care who you are. You've been in the crisis, you've been in the healthy, you've been in the stress. Some of us today have been on this spectrum just this morning. We can address those things and move along together. Where are we at time-wise? All right. So I love this picture. This is what I feel like we're doing most of the time. I feel like we are changing the tires on a car going down the highway. We have no time to stop this car. We can't pull over. We can't jack it up. We can't get the spare out of the back and put it on and then get back on the road. I feel like we can't stop driving most of the time because I live in all those worlds every day. I live in that micro, meso, macro every single day. We're making individual crisis calls. Yesterday, I was sitting how many of y'all went to the youth peer support workshop? Man, I love that. Paul reminds me of Mike. He's kind of off the cuff sometimes. I appreciate that in my life. That peer support group, as I was sitting there, I was getting texts from our alternative school principal who was trying to get a young man housing who had just got kicked out of his house. And I feel like this most days, right? I feel like I'm working with the micro, with the individuals. And then I'm still thinking about the rest of that spectrum. I'm still thinking about where we're going down the road, right? And so I explain that to a lot of people because oftentimes workers, you all that work with folks on all those levels, we get stuck in the drive, right? And we're not thinking about the destination. We're not thinking about the rest of that spectrum because we get caught. We get high caseloads or we get overwhelmed by systems or whatever it is, and we just get in that mode and we forget about the destination. So oftentimes I use this picture to describe that because I think it's hilarious, but it's very true because we still have to drive. and we still have to maintain, and we still have to head in a new direction. Does that make sense? So an important part to, and this is a whole bunch of words, this is death by PowerPoint right here, but it's very important to what we do and what we're doing in our community. Of this spectrum is how we are addressing these things in a formal way. 10 minutes. Thank you. So we formed a coalition, and on this coalition, we have some really cool work groups that are starting up, and those are led by co-chairs. The cool thing about this coalition is these folks on the other side are who are a part of the Kendall County Behavioral Health Advisory Coalition, the KBHAC. Our sheriff is a huge leader in that, and our chief of police for Barney PD, which is the main municipality in Kendall County, work together. They're co-chairs of this steering committee. Our district attorney and assistant district attorney are on that, county judge, city manager, the CEO, Todd Citron of Hill Country MHDD, which is our LMHA, superintendents of Bernie ISD, Comfort ISD, and we have a fiscal sponsor, fiscal agent would take in any grant money that we're offered to distribute that. This group is the decision makers in our county. They're all arrows, and they could be down at the bottom jumbled up like I had before, but they're all heading in the same direction, which is really cool. MHDD has applied for a grant for us to actually have a crisis worker embedded with our mental health team, our officers. We're also partnering with HHSC to have sequential intercept modeling done. Does anybody know what that is? It's really cool. Sequential intercept modeling is how mental health and the judicial system interact with each other in your area. So it's how we see this quite a bit, how cases are adjudicated. Y'all have heard of mental health courts, substance use courts, veterans courts, therapeutic courts. That's what this shows in your community. And we just so happen to have another district court that just got established by our legislature for our area so that we can adjudicate differently. We can have a mental health court, which is super awesome in my mind. We can have a veterans court, substance use court, and therapeutic courts are awesome and allow us to interact differently and not have people sit in our jail and have better services. So all of this to say, for you, how do you do this? I really want you to think about this as an individual. I love this. I had a professor that used to say to me, don't should on yourself. Should I have talked to somebody? Should I have done this? Should I have spoken up? I don't care what role you serve, where you are. You all live somewhere here in Texas, right? Does everybody live in Texas? How do you do this with your communities? How do you move your leadership to see that need that exists and be an arrow that heads in that same direction? Even if it's already established, how do you make sure you're plugged into it? Does that make sense? Because what we do every day with our clients is really important that we go through that process and understand it. All right, there's all our fun stuff. This giant QR code up here is we have a website for our mental health officers. It's very important that the people in our county and community know that these people exist. Like on that M&M's commercial with Santa Claus, they do exist. That's what I want everybody to pay attention to, is that Mike is not there to put handcuffs on you. He's there to support. Michelle and then Rebecca too, same way. And same thing with Krista. That's why I wanted them here. I really appreciate it because Krista's mind is exploding right now because school's about to start. So she was like, I'm so glad they're here to show you, though, that collaboration is very important. And I think we're finished. So if we have a few minutes for questions, we can do that. Absolutely. Yes, ma'am. Right over here. Sonia. There you go. Now, Sonia, you're going to be getting your steps like that the lady was the other day in the workshop.
Thank you. Okay. My name is Lasagna, and I spent many years in education, and I'm back with mental health, Bluebonnet Trails in Seguin. And so I was interested in the Hope Squad. We do have some individuals that we service that are 15, right at that age. And I know you said that it's a peer support. Is the Hope individual also a minor, or are they adults as well as students in school? I just kind of wanted to know a little bit more about how that works.
So, you got it? Okay. So there's actually, if you look up Hope Squad, if you Google it, it's an organization. They provide the training and the mentorship. So usually what happens is you identify a teacher leader who's going to sponsor that group, and they all go through a training through modules and so forth. But the students are nominated by their peers the previous year. So last year, students would nominate peers. The peers would accept, the nomination, and then go through the training. They do have shirts that they wear. They are identifiable, but it's a peer group, an identified peer group that they can kind of reach out to. But they also know on their campus, because all of our staff, it is a focus within Boerne and within our school district, the whole child, which I know has become kind of a catchphrase, but we really focus on maintaining the mental health of our students. So it is a common conversation. We do have conversations during advisory periods. We're trying to decrease that stigma so that kids can reach out and connect, and they can know who those safe people are on campus, whether it's a peer or an adult. Yeah, sure.
Any other questions from the audience?
I will say this too, sorry, being from the school district, because we can serve as that community person. Coming to Boerne from San Antonio Independent School District and Southwest Independent School District, just talk. Just reach out and connect. Don't have assumptions that that the school district's not going to be receptive to it. And if they aren't receptive to it, because it is a process, just keep talking, find the right person to talk to, and be persistent, because once you talk and you see the possibilities, it's not necessarily hard, it just takes persistence, because we all share the same goal, and that's keeping every person within your community healthy and safe. And so if you talk and reach out and connect, it's hard for someone to say, no, I don't want that, when you're talking just about caring about a person and keeping your community safe. So connect.
Yay.
Any questions on the Zoom, Sherry? All right, so if there's no more questions, we want to thank our panel here from Kendall County and from Boerne. Just a few reminders. Please remember to scan the QR code at the door. Please remember to fill in your conference checklist. And do that submission after the conference. There's a QR code on that page where you're marking off all the sessions that you attended. And then we do have our final keynote speaker that's going to be in the big text room. That's going to start at 10:15. So please join us in there, and thank you all for being here this morning and listening to all these wonderful things that are going on in our neighboring county.